We are going to talk about the American healthcare system, the pandemic, and Trump and Biden's views on these matters. First of all, I am going to talk about the American healthcare system and why it's the most expensive in the world. The United States spends way more than other countries but still has the least efficient healthcare system. In 2012, the US on average spent $8,745 per person on healthcare. Other rich countries like Switzerland and Norway spent a little over $6,000, and countries like Germany, France, the UK, and Japan spent in the $3,000 to $5,000 range. The US is spending twice as much per person as most other developed countries. Yet, they have the lowest life expectancy among these countries. Americans use expensive medical procedures more frequently than their peers. Last but not least, the US has the most preventable deaths among all the 11 members of the OECD, which includes countries like Norway, Sweden, Germany, France, Switzerland, Great Britain, New Zealand, Australia, the Netherlands, and Canada. These stats are worrying for a country that wants to be the best in the world. So what are the reasons for this? Well, I will tell you. First of all, the United States does not have a universal health program. Unlike most other developed countries, universal healthcare system is a system in which all residents of a particular country are assured access to healthcare. It usually provides either all residents or only those who cannot afford on their own. The basic structure of the healthcare system in the US. The United States has a different approach on healthcare. In the US, healthcare is split up into different sectors: the private sector, the public, and the voluntary sector. Private and public sectors supply insurance and care to most Americans. In private sector, 56% of patients pay for their healthcare with insurance they have got through their employer. The public sector insures the vulnerable groups. Medicare covers elderly Americans, and Medicaid covers Americans below a certain poverty threshold. Christian will talk more about this later. While it is normal to have a public and private sector in healthcare, the problem in the United States is that the private sector is so enormous. And it is the private sector that makes the healthcare system so expensive. In the US, every single private healthcare insurance company negotiates prices with the hospitals, instead of the government regulating the prices for everyone to follow, like in Norway. This makes the prices of procedures and drugs much more expensive for everyone. The free market is, in other words, bad at controlling the cost of healthcare. Drug costs are rising. On average, Americans shell out almost 4 times as much for pharmaceutical drugs as citizens of other industrialized countries pay. High drug prices are the single biggest area of overspending in the US compared to Europe, where drug prices are government regulated, often based on the clinical benefit of the medication. So why do they not change the healthcare system? Because it has become so expensive and beneficial for some people that it is hard to drive the prices down again. And that leads me to the Iron Triangle. The Iron Triangle refers to the mutually beneficial relationship between members of Congress, government bureaucrats, and lobbyists. Bureaucrats want to protect their funding and jobs, congressmen want to get re-elected, and lobbyists want to advance the interests of their clients. And they all end up working towards policies that maintain the status quo and aren't necessarily in the best interest of the people. That is why the US healthcare system is the most expensive in the world.
Okay, but moving on to Biden's versus Trump's views on the healthcare system. Healthcare was going to be the defining topic of the election because of the ongoing pandemic. The views of the contestants are crucial to stop the spread of the virus and the healthcare problems. These topics play a big role for which candidate the voters will vote for. Let's compare the contestants' views on the problems. The Affordable Care Act, ACA,
So Christian, I've heard something about the thing called ACA. Do you know anything about it?
Yes, you may have heard about Obamacare. Well, ACA is the same, but it's a different name. The Act has three main goals: make health insurance more affordable and available for people, support innovative medical care delivery methods, designing the lower costs of the healthcare generally, and expand the Medicaid program to cover all adults with income below 138% of the federal poverty level.
That sounds great.
The opposition's view differ quite thoroughly on Obamacare, which was enacted in 2010 by President Barack Obama. Donald J. Trump has been trying the best to overturn the ACA law since moving to the White House, unlike Biden, who is a supporter of it and wants to build on and expand it. Arguments have been brought up against the ACA Act in the Supreme Court. If the law is overturned, Donald Trump will have to quickly make a plan to address the possibility of millions of people becoming uninsured. The only part of the Act Trump has decided to keep is the protection of people with pre-existing conditions. But that would be really hard. The case is, COVID-19 would most likely become a pre-existing condition. This means that thousands of people would get free health insurance, or at least much cheaper. Trump doesn't want that. Therefore, he would have to make special laws to exclude some of the conditions the insurance won't cover.
Wow.
The problem is that people wouldn't buy insurance when they were healthy. They would wait until they got sick, and then buy insurance because the ACA would cover it. This would lead to an insurance pool with disproportionately sick people, and therefore much higher premiums. The ACA tried to encourage healthy people to buy insurance by including a mandate penalty, but it was repealed. They also provided help for the low and middle-income people only. Medicare is an option for people over 65. The system is financed through taxes. The system also guarantees affordable healthcare for people with pre-existing conditions. It is also an option available for people that are turned down by private insurers. So as we see, the ACA is for people with pre-existing conditions only. It's not as easy as it seems. It can lead to many problems. It is a good thought, but hard to make it come true, especially now under the pandemic.
So Christian, I've heard about Medicare and Medicaid. What's the difference?
Well, Medicare and Medicaid provides coverage for around 115 million people. Medicare is a federal health program. While Trump has promoted the private market and given the states control, Biden wishes to expand the eligibility to both of the programs. Some other differences in the ideal of the candidates is the lowest age to be eligible for Medicare and Medicaid. Trump's suggestion is 65 years for the federal program, while Biden wants to bring it down to 60.
Yeah, now I'm going to talk about the pandemic. Yeah, as you already know, in late 2019, a discovery occurred in the city of Wuhan that would change the rest of the world. I'm of course talking about the coronavirus. News outlets everywhere started to report a mass shutting of the city of Wuhan. But still, there was a sense of calmness in most people, while few thought it would spread to their country. But then it appeared in Thailand, Japan, South Korea, and at last in the USA. Of all the big democracies in the world, none were affected more than America. At the end of March, the US had the most confirmed cases of the coronavirus, and 32 of the 50 states had moved into lockdown. In just a few weeks, 10 million Americans lost their job, and a staggering 6.6 million people applied for unemployment benefits. This also affected the US economy extremely hard. Meanwhile, most other Western countries were deep into lockdown. President Trump encouraged protests on restrictions in several states. On the 27th of May, America had suffered 100,000 deaths. At the time of writing, 268,000 people have suffered from the coronavirus and are now dead. And Christian, by the way, have you heard about Trump's ridiculous suggestions on how to kill a virus? By injecting disinfectants and using UV light?
Yeah, but have you actually seen the interview? He didn't state that he's recommending doing it. He said that it sounds interesting as his helper was going to do an experiment on the two suggestions. I don't support Trump by any means. I just support the truth, and I think it's wrong by the media to spread false rumors. But let's move on.
Biden's response to the pandemic is to listen to science, completely different from the current president who has excluded the top health officials and often saying the opposite of their statements. Biden wants to give the leading role to the federal government, while Trump has given the power to the states. Trump's very clearly relying on governors and mayors to pick policies that they think are appropriate for their geography, says Douglas Holtz-Eking. The views of the candidates are quite different when it comes to the pandemic.
But Henrik, can you give some examples of the different opinions?
Yeah, here are some of the most important issues about the pandemic and the responses from the candidates. How involved should the federal government be in the response? Trump's answer: given the responsibility for the coronavirus to states, also has limited use of supplies from the Defense Production Act. Biden would put the federal government in charge of the COVID-19 response and use the Defense Production Act to ramp up production of masks, face shields and other personal protective equipment.
But Henrik, what is the DPA, or the Defensive Production Act?
Yeah, the DPA is the primary source of presidential authorities to expedite the expand of supply of materials and services from the US. Industrial base needed to promote the national defense. What should testing look like nationally? Trump appointed a coronavirus testing czar, but delegated testing strategies to the states. Signed legislations that eliminated out-of-pocket costs for coronavirus testing. Biden would provide free testing regardless of insurance, increase drive-by testing, twofold and push for the creation of at-home tests and instant tests. How should contact tracing work nationally? Trump made a contact tracing a core responsibility of states. Only a few states currently have enough contact tracers to help curb the spread. Biden would create the U.S. Public Health Jobs Corps to mobilize 100,000 contact tracers. How much money should go toward finding a vaccine? Trump invests around $12 billion in Operation Warp Speed to accelerate the development, manufacturing and distribution of the COVID-19 vaccines, with a goal of having 300 million doses by January.
That's quite a lot for so small amount of time.
Biden would invest $25 billion in a vaccine manufacturing and distribution plan. The drug and healthcare cost is a big topic in the ongoing election. Christian, do you have any information about that?
Yes, I do, Henrik. Drug and healthcare costs is where both candidates agree the most. They even have some similar ideas about the topic. Both of the presidents want to ban surprise medical bills without details. Trump has pushed hard on the Congress already. The lawmakers got close to dealing with surprise billing but failed when it came to agreeing on legislation. Trump has also used his authority to try and bring down drug prices down. Maybe some of these efforts will have effects. The problem is that the country will have to deal with the pandemic and the economy downturn firstly, and these things may slow the effects down. Biden wants to authorize the federal government to negotiate drug prices for Medicare and allow importation of prescription drugs with safeguards.
Christian, what's a safeguard?
Safeguard is USA's wellness program to maintain independent living with additional safety, security and peace of mind. Trump's view is similar. He wants to reduce insulin copays for some Medicare beneficiaries, support international reference pricing and importation of prescription drugs, and also with safeguards. I have some information about other health issues too. With all the attention on the pandemic, economical downhill and other issues, people have missed how the candidates' view on other health issues differ. Joe Biden's platform has quite opposite views on the issues than Trump. The view can be summed up in: do everything the opposite and undo everything that President Trump has done. The pandemic has some serious consequences on other important health issues. It has led to much more mental health issues, opioid use disorders and racial health disparities. Here are the candidates' views on the three important issues regarding the health problems.
A crisis that has been neglected lately is the opioid crisis. What's their views on that?
Trump have declared the opioid crisis a public health emergency in 2017. He has released a national strategy with a focus on reducing overprescription, targeting drug traffickers and increasing access to treatment. Biden, on the other side, he would increase access to treatment services for opioid use disorder. He would curb opioid prescriptions and prosecute pharmaceutical companies. Would they address racial health disparities? Trump, he has no plan to reduce racial health disparities. Biden, he wants to establish a permanent infectious disease, racial and ethnic disparities task force. What mental health support should be available? Trump has signed a legislation creating 988, which is a national hotline for mental health emergencies. He has created a task force on suicide prevention for veterans. Biden has promoted suicide preventions for veterans and LGBTQ youth. He would expand the mental health workforce. As we see, the election will go down in history as one of the most important elections. The problems of healthcare are considerable, and under the current pandemic, its flaws are showing more than ever. Electing the right president will be very beneficial for the future, and maybe he will implement some important changes.